Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the fifth video of rapid revision course of oral medicine, which is very important for NLE exam, MDS and BD as well as for BDS students. In this video we will discuss about everything about erythroplakia. Now we will discuss in detail about definition of erythroplakia, clinical features, types, diagnosis, etiology and treatment. First, what is the word erythroplakia mean? Erythro mean red, like in erythrocyte. Erythro mean red and plakia mean patches, mean red patches, mean red lesion. Now, how we define erythroplakia? Erythroplakia is a bright red velvety patches. There is a velvety patches like velvet. Here, look at there is a velvety patches on the mucous membrane that cannot be attributed to any other diagnosable disease. Mean it cannot mimic the other diagnosable disease or match or show similarities with other disease based on clinical and histopathological finding. This is the definition of erythroplakia. Now come to the clinical features. In clinical features, first age. Erythroplakia occur in age from 5th to 7th decade. Mean age about then 50 to 70 years. Sex, there is no apparent sex predilection. Mean it occurs equally in both male and female. Next is a site. Erythroplakia may be found on any side of the mouth, but there are certain areas, for example, floor of the mouth, ventral surface of tongue, soft palate, retromolar area, and anterior facial fillers which exhibit high frequency of epithelial dysplasia. This is a common site. Now come to the types. There are three types of erythroplakia. Number one is red patches, which is known as erythroplakia. Second is the red and white patches. Mean red patches and white patches are occur with each other. Mean both white and red patches are present in the oral cavity of the patient. Third is the speckled erythroplakia. Speckled erythroplakia we already discussed in the fourth video in white lesions. Speckled erythroplakia is in speckled erythroplakia the base of the lesion is red and above there is a white lesion, there is a hyperkeratosis. And the more malignant potential of the oral precancerous lesion is erythroplakia. Then next is the speckled erythroplakia. This is the speckled erythroplakia. We already discussed about speckled erythroplakia or speckled leukoplakia. The base is red, but above there is a white hyperkeratosis. Now, these are the types of erythroplakia. Now, come to the next. Erythroplakia appear as the area of bright red velvety patches with well-defined margin. Look at here, there is a well-defined margin and velvety appearance. Look at this diagram, velvety appearance, look like velvet clothes. Here there is a velvety appearance. The lesion may be smooth or exhibit granular texture. Look at here in diagram, on the right side there is a granular texture, but on the left side there is a smooth texture. And this texture and is supple. Supple means flexible to touch. Although some induration may be felt in invasive lesion. When lesion become invasive, then there is a induration, mean hard areas. But usually it is flexible. Erythroplakia may occur alone or with area of hyperkeratosis. Mean erythroplakia may occur alone or with combination with area of hyperkeratosis. Like in type 1 there is a alone erythroplakia. In type 2 there is a both red and white patches are present. Almost all patients with erythroplakia have no complaint. There is a no pain. It may be discovered during routine dental examination. When we examine the patient, accidentally we find there is a red velvety patches. At least 85% of erythroplakia are severely dysplastic or frankly malignant. Like in investigation per leukoplegia, what lesion we already discussed. First, we applied toluidine blue solution 1% on that area. The malignant cell, the dysplastic cell, retain this color. And when we wash with acetic acid, 1% acetic acid from other cell, the toluidine blue color is removed, but dysplastic cell retain this toluidine blue, and toluidine blue will not remove from the dysplastic malignant cell. Then on that area we take biopsy and send. If the lesion is small, we excise the lesion and send for pathological investigation, mean excisional biopsy. If lesion is large, then we go for incisional biopsy. Now here, toluidine blue solution can differentiate between lesion of inflammatory origin from those of precancerous and cancerous variety. Now come to the etiology. The etiologic factor for erythroplakia are similar to those responsible for oral cancer, which is tobacco, alcohol, nutritional deficiency, and chronic irritation. Next, erythroplakia is a serious lesion because of high rate of malignant potential. Mean in precancerous lesion, the more malignant potential lesion is erythroplakia. Then there is a speckled leukoplekia, which is combination of leuco and erythroplakia. Now come to the treatment. The same line of treatment of leukoplekia is applied for erythroplakia. Like for leukoplekia, we already discussed in a 4th video of rapid revision course. Same apply for erythroplakia. Biopsy should be done as soon as possible, and in meantime remove all local irritant without delay. Since this lesion have high rate of malignant transformation, the ideal treatment of erythroplakia is surgical excision. Now the important point for MCQs is that in erythroplakia, first there is a bright red velvety patches. Second, it mainly present on the ventral surface of the tongue, floor of the mouth, soft palate. Next, in 85% erythroplakia show dysplasia, and erythroplakia is painless, and the etiology of erythroplakia is same like oral cancer, tobacco, alcohol, nutritional deficiency, and the next MCQ's point is the most pre-malignant lesion which show high potential for malignant transformation is the erythroplakia. The ideal treatment of erythroplakia is surgical excision. This is all about erythroplakia. Now today our topic is complete. In next video we will discuss next topic of oral medicine. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.